My question is to Dr. Pelayo again. I wanted to check, at which point do you figure out that your child may be having a sleep disorder? I mean, it's possible that the child is moody and cranky because he's going through a phase, or somebody will tell you, oh, well, all boys of this age at this time seem to get this way, or all girls, whatever. I just want to figure out when, do you suffer it for a year or 2 years before you go like, there must be something other than just a personality thing here?
There's 88 different sleep disorders, so it depends which disorder you're talking about. But if you have a concern about the way your child sleeps, if you are concerned about it, there's no harm in going and asking for an evaluation. We're not saying they need sleep tests. All you're asking for is to speak to a doctor, speak to your pediatrician as your first line, or your family practitioner as your first line person to ask about sleep. If you're not satisfied, ask for a referral to the sleep clinic. And then we're not going to do a sleep test. We're going to have a sleep office visit. We're going to talk for about an hour about how your child is sleeping. The clues would be if the child is unrefreshed in their sleep, seems tired, maybe irritable, snoring, moves a lot, thrashes, sleepwalking. We didn't talk about that. Night terrors. There are all kinds of sleep phenomenon that can be happening in a child. I saw a kid today who was banging his head at night. So there are all kinds of things that we can address. So the main thing is, if you suspect your child isn't sleeping well, there's no harm in asking for an office visit. Not a test, an office visit.
So then the first step is to observe the child through one night, kind of watch him sleep.
The first step for the parent?
Yes.
I think, if you have a sense that your child is not sleeping, here's an easy way of doing it. Let's say you have a child who, let's say, a 3-year-old, right? If I'm 3, where do I want to sleep? With my mother, right? Ideally, who do I want to sleep with? If I could have things my way, right? If parents say, listen, the kid doesn't sleep well at night. And I say, well, if the parents move into the kid's room, not bringing the kid into your room necessarily, but if your parent moves into the kid's room, if the kid sleeps great, then they say, okay, maybe a behavioral thing. But if the parent moves into the kid's room after 3 to 4 nights, the parent says, I can't sleep with him. He's all over the place. He still sleeps. He still wakes up a lot. He's all over the place. Now you got to think it's maybe something physical. Reflux, heartburn can make somebody not sleep well. Allergies. So a quick thing to do is have the parents sleep with the child in the child's room. If the child sleeps great, then you say maybe behavioral things that we can address. If they sleep poorly still, then you can consider bringing the child in for an evaluation. Thank you.
We have another question here. I do have a question as we're going there to Leah about posture. At what age does a parent need to be mindful of posture? Is it something that we start with, infants and toddlers? And then my second follow-up question to that is the benefits of wireless versus wired mouses. Is there a postural benefit to one versus the other?
Okay. So to address the first question in terms of when to be aware, I think it's really important to look, start young. Obviously, when they're infants, especially infants that are learning to walk or just learn to walk, will have a different posture. So those guidelines that I talked about earlier won't necessarily apply. But, even as children are starting school, I have kids that come to me all the way from 0 up to 18. So I look at a kid's posture every time they come, even if they're 3 years old, 4 years old. And just to notice if there are certain preferences that your child has, because they really shouldn't have too much of a preference for, especially an easy way to look is, do they have a preference for one side? And this is minus the right-handedness or left-handedness of your child, but, is he preferring one leg? Does he always lead with the one leg when going up the stairs, or is he always leaning one way? But I think it's never too early to really just look at them as, young as like 3 years old. Like I said, infants who have just learned how to walk have a different posture just because they're still trying to figure out their balance. But I'd also like to say, you also really want to keep an eye on kids because, I know at school I think they do scoliosis screenings, but, you want to be aware of things that you might want to bring up with your pediatrician if you observe things. And, like I said, I look at a kid's posture every time they come to see if that's affecting what they're coming in for, or affecting their weakness, or affecting their pain, or vice versa. And to talk about the mouse, I wouldn't imagine, I haven't seen any studies on it, but in terms of the wireless mouse versus, that was your question, right? I don't think the wire versus wireless, but more so the positioning of your forearm and hand when you're using it and where they are in terms of the table height.
And then we had a question here.
Yeah, my question is about sleeping. So is there somebody just like born the way they are the night persons?
I'm sorry.
You know,
I was asleep when you started.
I think my son's like when he was young, you know, if I put him in the bed like 9 o'clock, he will spend 1 hour tossing on the bed.
Yeah.
But now he still like sleep late. And, you know, in the school time, he has to get up early. And, you know, in the weekend, just make up some sleep. So I'm not sure is this, you know, he born this way. You know, he just cannot fall asleep if he goes to bed too early.
Yeah. How old is your child?
15. I think because the father is exactly same way.
Yeah.
But mom is not this
Right.
way.
Well, you know, tendency to be night owl is genetic. There are genetic tendencies to be a night person, and they actually can now track that gene out. So that's been worked out. There's a genetic thing for this. But also, part of normal human sleep, it's always easier to push away sleep than to advance sleep. If you think of your normal bedtime, let's say your bedtime is 11 o'clock at night, and somebody asks you to go to the airport to pick them up at 1 o'clock in the morning, you probably would just stay up 2 hours to go pick them up at the airport. You would not go to bed at 8, sleep till 12, and then go get them. It's always easier to push away sleep than to advance sleep. It turns out that human alertness, our alertness is not a steady state. We are more alert at certain times of the day. If sleeping was like gasoline, your car has the most amount of gas when you leave the gas station, right? If sleeping was like gasoline, you'd be most alert first thing in the morning, but that's not true. We're not that alert first thing in the morning. We're actually more alert mid-morning, then we get a drop in our alertness in the afternoon, and the kicker is peak alertness for humans is in the evening. We're more alert 2 hours before we fall asleep than any other time of the day. We all get a second wind at night. That's part of the human condition. If it really is true that humans are prone to being attacked when they're sleeping, you should be most alert before you go to sleep. So we all get a second wind. And that's the biggest mistake parents will make with their children. If you're frustrated with your child not being able to sleep, you'll typically say go to bed earlier. Earlier you go to bed, the bigger hassle it is, and the bigger nuisance it becomes. It's actually better to make them go to bed a little bit later, like 15 minutes later. Okay, so with your teenager, they have genetic reasons why they may like to stay up later. And there may be other circadian or time-related reasons why they're staying up late. Finally, we also know that in our community, Asians are more prone to sleep apnea than non-Asians. Something to do with the characteristics of the skull are different. So there's some studies showing that with our large Asian population, we're seeing a lot of thin, both adults and children who have Asian parents who are more prone to sleep apnea. So your boy's restlessness when he was an infant may be a different reason why he wasn't sleeping well now that he's 15. There may be more than one thing going on.
Well, I want to thank everyone. If we could just sort of entertain our questions perhaps a little bit more casually and just encourage everyone to stand up, enjoy your posture, dairy and fiber intake, perhaps a couple lunges on your way to the buffet, and enjoy your second wind before your regulated sleep cycle. I just thank you all for coming. I thank all of our panelists as well. Just thoroughly enjoyed your presentations. I encourage you all to dialogue with them following this, and thank you. If you'd like more information on any of these presentations, go to lpch.org, which is our Packard Children's website, or more information on the renewal and replacement of our hospitals, visit the table in the back or go to stanfordpackard.org. Thank you.